Is this working? Thank you, Lila, for letting me do something a little different. I wanted to tell you my idea came from going to the Aspen Ideas Institute Ideas Festival. And this summer, George, was their 10th anniversary. And their theme was Envisioning 2024. And that just thrilled me. 2024, that just seemed great. And so I thought, what a great idea for a panel to ask, and they said, here's the Aspen Ideas Festival said, there were no lectures, just interviews, usually in a panel, with interesting thinkers and thought leaders about their vision for the next 10 years and issues that inspired them. So I'm going to ask you what inspires you and your vision for the next 10 years, and maybe what your action plan is to getting there. All of you have a little niche in health literacy, population health, disparities research, and I want to start with Betsy, and I first want to tell you, you moved the needle tremendously when you got that definition set, published, and disseminated. And so it's like so much has happened in the last 10 years. Where do you see all of this going in the next 10 years? You know, what's your vision?
Well, the way we move that ahead so easily is that we just enlisted, you know, Ruth and Scott to write the definition, and then we just published it. So they certainly get the credit for that. Where do I see it all going? I was just talking to Rima, and I think that health literacy is going to move ahead. It's sort of like what Howard was saying this morning, by being integrated and becoming an important part of other things that people are really interested in. I think we heard this theme all this morning, I mean, from all the speakers. Well, you can't have health literacy as a separate thing, but you can integrate it into the curriculum in various ways. And that's what I think is going to happen going forward. And since I, on this list, was listed as somebody who knew about technology, there are a lot of people at NLM that would laugh about that, but at any rate. But I do feel that we are at this place where we could all envision how health technology could have a major impact, because it actually, for some patients, could make the job of being a patient easier for them, whether it was wearable technology or various things. However, Ruth brought up the cautionary tale, you know, the 57 apps. So we don't yet, in my opinion, have the kind of really useful, helpful technology that would help patients either understand something better. Dare we ever hope that health technology will help explain risk to even a health professional, let alone a patient? But I think I can envision that happening. And I also can envision that we would, with every new device or something or new application, we have an excuse to actually engage people who might use it. People accept that. I'm building a new device. Let's see if you can use it. And they don't feel that way about the things they've been doing wrong forever, because it's not new. We all understand those, right? But when it's something new, I think we can actually get a more patient-centered or person-centered or health-centered. Let's find out if seniors will really use this. So I think we need to integrate it with many things, and one of them is the sort of development of health IT that we think will help people manage their own health.
So that's insightful, because it's not just a bunch of nerdy guys inventing apps. It's really useful tools, and part of what I hear you saying is to engage like seniors or the target audience in what is really can they really use it? Is it going to help them with their behavior or improve their health outcomes? Where do you think, who do you think would drive this?
Well, I have to say that I'm proud of the fact that the National Library of Medicine is part of NIH. And as you know, NIH has funded a lot of interesting research. And some I'm familiar with is the National Library of Medicine doesn't have a huge extramural research budget, but we think we spend it well on some interesting projects. And of course, the National Cancer Institute. There are many institutes that have done a lot in terms of how can we do things in a way that will help people manage and understand. One of the things that I like I was just listening to a presentation by somebody that NLM funds, where they actually went out and did focus groups with seniors about health alert devices. You know, the thing that you wear that might, if you fell or if you did this. And it turns out that they don't like those devices, or a lot of them don't. They want a device, but they don't want one that makes them look like an old sick person. They don't want one with certain characteristics that automatically calls the ambulance for them, and then they're embarrassed in their neighborhood when the ambulance comes. So what they wanted was a watch. Then they could wear a watch, and it could have certain characteristics, and no one would look at them and say, this is an old sick person who's afraid, or an older person who's afraid is going to fall. Well, that's just one example. I think that we need more examples like that, and I think we need to support the development of new cool things, but then we have to see whether they really are applicable to helping people.
Does that come out of the private sector?
I think it comes out of both. Obviously, NIH has a small business incentive research program, and this is an area where actually in the sort of M-Health area, there's a lot of interest in NIH focusing its small business research dollars in that area. So
I want you to comment a little bit on social media. I encountered this in healthcare with mommy blogs when I was doing some AAP development of newborn screening materials. And so sometimes these mommy blogs are good, and then sometimes it's not great information. I mean, it was an Arab Spring driver politically, but can you comment how you see this going in healthcare?
Well, there's a huge use of social media for health-related and healthcare topics, and it involves everyone. It involves the CDC and the NIH, and NLM as part of the NIH, and there's a lot of great information that's going out in a variety of social media platforms, and that's all good. If there's nothing to prevent anyone who uses social media from saying whatever they want about whatever health information or misinformation they have, and this genie is out of the bottle. It's always been out of the bottle. It's just that the misinformation can potentially be spread in a broader way than it used to be, you know, maybe down at the bar or at the coffee clutch or whatever. There's nothing to be done about that. It's going to happen. So I think what I have always felt that a good goal for the National Library of Medicine is to try to make very high quality information understandable and available to anyone who goes looking for it. And whatever we can do to make our information, or the information, obviously we don't write it, we get it from the rest of NIH, CDC, and the professional associations, but if we can sort of make it look as interesting, as fun, as whatever is going around, and do whatever we can to make it easier to find the good stuff than it is to find the bad stuff. I think that's all we can do.
So do you see that as a role for NLM playing in health literacy over the next 10 years?
Yes, that's definitely one of it. To organize the great information that's coming out that's at appropriate levels and written for different audiences in multimedia, because that's can help communicate to some people when just the words can't. That's one of our main ideas, things for us to do. The other one, of course, is to make the results of research about what works and doesn't work and what these new devices can and can't do accessible to everyone, including the professional community. That's just part of our larger mission, obviously, of making the results of research available.
Do y'all do the translation into the plain language deal, or?
We produce what I would say is a relatively small amount of information in plain language at the National Library of Medicine itself, but many other federal agencies and other parts of NIH do produce it. So what I think we do well is organize the information so that you can come into, for example, our Medline Plus website in English or Spanish and find collected useful information, including the easy-to-read stuff, which is, of course, what we call it, no pejorative title attached to it. Make it easier for people to find it. And occasionally we do produce some in certain areas ourselves.
When you envision 2024, do you think there'll be print medical journals?
That's a good question. I don't think that we will have necessarily have print medical journals. I suspect that we will still have print children's books. And one of the things that I think we will still need, as we heard this morning, is we will need the personal interaction to underserved and vulnerable populations. And that's something that my library colleagues across the country, not only public libraries, but also public librarians, but health sciences librarians in hospitals and university librarians, because they can be dealing with the student population in terms of health literacy and literacy generally. And, you know, librarians have a very good rep. People like them. And I think we'll probably still have libraries in communities, public libraries, because people will like a nice, clean, safe place to take the kids or to go themselves, to know that the person that they're going to greet is going to be friendly and not talking down to them, and what's your question, and can I help you? And so I really think that the library community is a great partner resource for literacy in general, but definitely for health literacy.
You know, that's a great point. I think people do like librarians and they trust them, and you're not trying to sell them something or tell them something. You're just trying to help them. And so I think that's a nice thing to think about with librarians. So what do you think the public library is going to look like? I ask you this because in Aspen, they said one of the things, if you were from Mars and you came back after being gone 150 years, one of the things that would look the same now, and it's changing, is the schoolroom, the classroom. But by the year 2024, we might not recognize our schools. They'll be configured differently. Everything's going to be all wired. Maybe promotions based on skills and accomplishment rather than seat time. So what do you think the library is going to look like in 10 years?
Well, you know, it's interesting because I think all the ideas that you described about schools have already been experimented with or done in some areas over the last 50 years. I mean, I actually, you know, that remake the classroom. So I think most of us here will be here in 2024, so we can find out whether we actually still recognize a classroom or not. I think that from the point of view of the public library in particular, that we still want a nice, pleasant, centrally located, one in every community, inviting place with nice people in it to help you either find books for your kids, or answer questions, or get pointed, help pick up the latest information about your tax forms or about your health insurance.
You know, it's interesting, you're talking about technology and information, but the theme there is the helpful librarian, the face, the person that'll help you with the problem that you have.
Yes, I mean, everybody always talks about high tech, high touch, but I think that in the area of really helping people who don't understand something or don't know yet enough to know what they understand and they don't, it's, you know, talking to a helpful person is not going to go out of style.
You're a good poster child for librarians. So at the end, you'll have plenty of time for questions for Betsy, but I want to move on to Steve.